How can I identify my bladder irritation triggers? If you've ever felt that sudden urge to go to the bathroom or experienced discomfort in your lower abdomen, you're not alone. Many people deal with bladder irritation, which can be caused by a variety of factors. Understanding what triggers your symptoms is key to managing your bladder health effectively. Bladder irritation happens when the lining of the bladder becomes sensitive or inflamed, leading to symptoms like frequent urination, urgency, and sometimes discomfort. It's important to remember that irritation doesn't always mean something serious like bladder cancer. Often, common foods, drinks, and lifestyle habits can play a role. But if symptoms are persistent or severe, it's best to see a healthcare professional to rule out other conditions. Medical experts agree that certain substances are known irritants for the bladder. For example, caffeine found in coffee, tea, energy drinks, and chocolate can increase urine production and irritate the bladder lining. Alcohol can have a similar effect, making symptoms worse. Spicy foods such as hot peppers or curry may also irritate the bladder, especially if eaten in large amounts. Acidic foods like oranges, lemons, tomatoes, and other citrus fruits can cause irritation as well. Artificial sweeteners, often found in diet sodas and sugar-free products, are another common trigger for some people. Carbonated beverages, including sodas and sparkling waters, may also contribute to irritation. Dehydration is another factor to consider. Not drinking enough water can lead to concentrated urine, which can irritate the bladder. Conversely, drinking too much fluid before bed might cause frequent nighttime trips to the bathroom. Constipation can also press on the bladder, increasing urgency and discomfort. Emotional stress and anxiety are known to influence bladder function, sometimes leading to increased urgency or frequency. Cold weather can also make symptoms worse for some individuals. To figure out what specifically affects you, keeping a bladder diary is highly recommended. Start by writing down everything you eat and drink each day, including medications. Note when you experience symptoms like urgency, frequency, or discomfort, and how intense they are. After a week or two, review your diary to see if certain foods or habits seem to trigger your symptoms. Once you identify potential irritants, try eliminating them one at a time for a few days to observe if your symptoms improve. If they do, reintroduce the suspected trigger gradually to confirm its effect. Making small adjustments can make a big difference. Begin with a bland diet and slowly add back foods to see how your bladder responds. Stay well hydrated but avoid drinking large amounts of fluids right before bed. Managing stress through relaxation techniques can also help, as emotional factors can influence bladder symptoms. Avoid smoking, as harmful chemicals in tobacco can irritate the bladder lining. If your symptoms are severe, persistent, or accompanied by warning signs like blood in the urine, pain, or fever, it's important to seek medical advice. These could be signs of a more serious condition, including bladder infections or even bladder cancer, which requiring professional evaluation. Early detection is crucial for effective treatment. While most bladder irritation is caused by benign factors, it's important to understand that similar symptoms can sometimes be related to bladder cancer. If symptoms do not improve with lifestyle changes, or if you notice blood in your urine or other unusual signs, consult your healthcare provider promptly. They can perform tests to determine the cause and recommend appropriate treatment. Remember, there is no scientific evidence that avoiding all potential irritants will prevent bladder cancer. However, managing your diet and lifestyle can improve your overall bladder health and quality of life. Always relying on reputable health sources and medical advice tailored to your individual needs. In summary, identifying your bladder irritation triggers involves paying close attention to your daily habits and symptoms. Keeping a detailed diary, making gradual dietary changes, and managing stress can help you find what worsens your symptoms. But never ignore persistent or worsening issues. Consulting a healthcare professional ensures you get the right diagnosis and care. Your bladder health is important, and understanding your personal triggers is a positive step toward feeling better and maintaining overall urinary wellness.